So they gave me 10 minutes to talk a little bit about the Mind Institute. For those of you who haven't been here before, just a little bit about our history. We were founded by families in collaboration with the University of California and the California Legislature, and we have carried this focus on families and advocates throughout our history and continue to do so today. We opened our research clinic in 1998. And this building and the biosciences building next door in 2003. We now consist of over 60 faculty, about half housed in these two buildings, but the other half here at the medical center or on the Davis campus. And so one of the things we're really excited, continue to be excited about, is the cross-disciplinary nature of our work. We have been doing work as sort of legislated by our mission in the beginning of supporting basic research from basic sciences through intervention and now moving into implementation, assessing, supporting, and educating patients with neurodevelopmental conditions, translating those findings into the community across all of those areas, creating patient databases so we can better understand the course of these conditions, and you'll hear about probably some of those today, training the next generation of people who are working in research in this area, clinicians and advocates in the community, and then of course working with our government, state and federal on policy. And so we continue to do that, and we will continue to do it. And one of the things we've done is really work with families and advocates and change as our community changed. And so we've updated recently our vision and our mission for the Mind Institute. And we envision a world where all people with neurodevelopmental disabilities can live their best lives. And we do that, we believe we do that, by developing more personalized, equitable, and scientifically validated systems of support and interventions. And so we have research across the spectrum from very early work in genetics, early basic sciences, biological sciences, looking at animal models. We have studies of the earliest behavioral characteristics of babies with different neurodevelopmental conditions. We've got large-scale projects focused on the environmental effects on development, and we have studies about interventions, both medical and behavioral, and how to move those into service systems. And we've been working very hard to do all of this work in collaboration with the community. And so just a tiny bit of examples of some of the work we do, a little bit of the history that led up to this panel today. And these are just early examples, or just, I guess, brief examples of the kind of work in this area, because we don't have time to talk about it all today. But we began working in the very early intervention and identification in the early 1990s with the collaborative programs of excellence in autism that are now Autism Centers of Excellence, and we've been part of those throughout the duration. And those were landmark studies looking at early development, early intervention, and how to support kids and what the course was for autism. And that's led to autism intervention. For early intervention research here, Sally Rogers developed the Early Start Denver model, came out of those programs, and we've been looking at adapting that model and other models for community use for different groups of people, different populations, and really disseminating that nationally and internationally. Similarly, after those early studies, really looking at the early identification, we were in the very first baby siblings network with Dr. Weigenbaum as well. 27 sites worldwide started looking in the early 2000s so that we could look at the earliest ways to identify autism in young children. And that's led to Next Generation Sibling Study, which we're part of now, looking at those next generation of siblings and how we figure out what happens next. And some of the research you'll hear about today stems from that in terms of looking at pediatric universal screening in our communities, telehealth screening and identification, and really harnessing technology to better identify autism in other neurodevelopmental conditions that we may or may not be able to tell apart from autism early on, and how to best direct families to services as early as possible. So just some examples of the work we've done there. And then they told me I could tell you a little bit about where we're going next, and I will get to the next folks soon. But we've been working very hard on developing our inclusion, diversity, and equity throughout all of our processes, programs. And this is something we will continue to work on future forward. We've been building community partnerships in all areas of research, in our clinic, in our educational programs, building our infrastructure to support diverse patients, diverse trainees, and faculty, really working on our recruitment and retention, scientific initiatives, and service access for many people by building capacity in our community. So we will continue to do that, and we will do it in collaboration with the community in all of these areas. So we really have a commitment to working with the community, not grant by grant, but in a sustainable way where there's a give and take, and we are giving back both through clinical services and research and taking input to guide our next scientific and clinical initiatives. And so our strategy is to continue to be the best in all of our areas of basic science, to translate that clinical and behavioral research and basic science into clinical services, and then to move all of those out into the community and including training the next generation of people. And so we at the Mind Institute have a history of putting all those things together, and we will continue to do that.
The UC Davis Mind Institute was founded in 1998 with the promise to reduce and prevent the disabilities that can be associated with autism and other neurodevelopmental conditions. Every day, our clinicians and researchers make progress on that promise. Our groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other conditions associated with disability are helping affected individuals achieve their fullest potential. Please visit our website or our social media platforms to find out more about current studies, upcoming events, and how you can help make a difference.